What if I told you that one of the most powerful vascular support compounds for men over 60 is sitting quietly in your kitchen cabinet, and that when it's combined with one specific overlooked ingredient, it can meaningfully improve blood flow physiology in a way that most men are never taught? Not through a prescription, not through an injection, not through an expensive supplement stack, but through a biochemical mechanism that modern medicine understands very well, yet rarely discusses in practical, everyday terms. I am a board-certified men's health physician. I have worked with men for over 2 decades, men in their late 40s who noticed subtle changes, men in their 50s who felt their stamina decline, and men in their 60s who quietly wondered whether circulation issues were simply the price of aging. And I want to be very clear from the beginning. Aging itself is not the disease. The problem is vascular deterioration. Now, let's address the skepticism immediately, because I know you're thinking it. If something as simple as cloves, when combined correctly, can support blood flow, why aren't doctors prescribing it? The answer is not conspiracy. It is economics and structure. Whole food compounds cannot be patented. If a molecule cannot be patented, it cannot be exclusively marketed. And if it cannot be exclusively marketed, there is very little financial incentive to run multi-million-dollar trials around it. So it gets ignored. Not because it doesn't work, but because no one owns it. Now let's shift from theory to physiology. When a man crosses 50, 3 major biological changes begin to converge inside the vascular system. The first is structural vessel stiffness. Arteries are not rigid pipes. They are living tissue composed of smooth muscle cells, collagen, and elastin. In youth, elastin fibers allow vessels to expand and recoil easily. Over time, glycation, which is sugar binding to proteins, and oxidative stress damage those elastic fibers. Collagen becomes more dominant. The vessels become less compliant, less flexible. That stiffness alone reduces perfusion efficiency. The second issue is blood viscosity. As men age, low-grade inflammation increases. Hematocrit can rise. Fibrinogen levels can increase. Platelet activity becomes slightly more aggressive. The blood becomes marginally thicker. Not dangerously thick, but thick enough to slow microcirculatory flow. And the third, and most important, is endothelial dysfunction. The endothelium is the inner lining of your blood vessels. It is not passive. It is metabolically active tissue. It produces nitric oxide, which is the signaling molecule responsible for vasodilation, the widening of blood vessels. Nitric oxide activates an enzyme called guanylate cyclase that increases cyclic GMP, that relaxes smooth muscle, that allows blood vessels to expand. After 50, nitric oxide production declines significantly. Why? Because the enzyme responsible for producing it, endothelial nitric oxide synthase, or ENOS, becomes less efficient. Oxidative stress degrades nitric oxide faster than the body can produce it, and levels of a molecule called asymmetric dimethylarginine, or ADAMA, increase, which directly inhibits nitric oxide production. So you have stiffer vessels, thicker blood, and weaker nitric oxide signaling. That combination compounds. And this is why men often experience gradual but noticeable changes in circulation after 55 or 60. Now let's talk about cloves. Cloves contain a bioactive compound called eugenol. Eugenol is not folklore. It is chemically active. It has been studied for anti-inflammatory, antioxidant, and vasodilatory properties. Mechanistically, eugenol does several things that are highly relevant to aging male vasculature. First, it reduces oxidative stress. Oxidative stress destroys nitric oxide. When reactive oxygen species increase, nitric oxide gets converted into peroxinite, a damaging compound. By acting as an antioxidant, eugenol protects nitric oxide from degradation. Second, Eugenol has mild calcium channel modulation effects. Calcium influx into smooth muscle cells triggers contraction. When calcium channels are overly active, vessels remain more constricted. Eugenol appears to modulate calcium influx, allowing smoother relaxation of vascular tissue. Third, it has antiplatelet activity, not at the level of pharmaceutical anticoagulants, but enough to reduce excessive platelet aggregation. That slightly improves microvascular flow. Again, subtle but physiologically meaningful over time. Fourth, it reduces inflammatory mediators such as TNF-alpha and certain prostaglandins. Chronic inflammation stiffens vessels. Lowering inflammatory signaling improves endothelial responsiveness. But here is the critical point, and this is where most men misunderstand. Cloves alone are not the full solution. Eugenol works best when paired with a compound that supports nitric oxide synthesis upstream. That compound is L-arginine, or even better, L-citrulline, which the body converts into arginine more efficiently. Let me explain why this pairing matters. Nitric oxide is synthesized from L-arginine via the enzyme eNOS. However, oral L-arginine is partially broken down by the liver before it enters systemic circulation. L-citrulline bypasses this first-pass metabolism and converts into arginine in the kidneys, leading to more stable plasma arginine levels. When you combine cloves, which protect nitric oxide and reduce oxidative degradation, with a substrate that increases nitric oxide production, you create a dual-action effect. Production increases, breakdown decreases. That is intelligent physiology. This combination addresses two of the three major vascular barriers we discussed earlier: endothelial dysfunction and inflammatory stiffness. It does not reverse aging overnight, it does not replace medical treatment where necessary, but it meaningfully supports vascular function when used correctly. And this is where theory often falls apart in real life, because understanding a mechanism is one thing, applying it properly is another. Now that you understand the biological mechanism, theory means nothing without correct application.
Most men fail not because the ingredient doesn't work, but because they prepare it incorrectly. This is where physiology meets practicality. And in my clinical experience, this is the exact point where promising natural compounds lose their effectiveness, not because the science is flawed, but because the execution is careless. Let's start with the cloves themselves. You must use whole cloves, not pre-ground powder. Powdered cloves oxidize rapidly. Once ground, the surface area increases dramatically, which exposes volatile oils, especially eugenol, to oxygen, light, and moisture. Within weeks, potency drops significantly. What you are left with is aroma, not therapeutic density. Whole cloves protect their volatile compounds within the dried bud structure. When stored properly in a dark, airtight container away from heat, they retain bioactive strength far longer. There is also a simple freshness test. Place a whole clove in a small glass of room temperature water. If it sinks or stands upright with the bulb downward, it still contains adequate essential oil density. If it floats flat and remains horizontal, most of its oil content has degraded. That oil content matters. Eugenol is lipid-soluble and volatile. Mishandling it destroys the very compound we are trying to preserve. Now let's address preparation. Many men make one critical mistake. They pour boiling water directly over cloves and leave the cup uncovered. Boiling water aggressively vaporizes essential oils. If the cup is uncovered, you can actually smell the active compounds escaping. That aroma is potency leaving your preparation. Instead, water temperature should be hot but not violently boiling, ideally around 80 to 90 degrees Celsius. If you do not measure temperature, a practical method is this. Bring water to a boil, then allow it to sit for 60 to 90 seconds before pouring. Before adding water, you must crush the cloves, not grind them into powder. Crush them lightly using the back of a spoon or mortar. The goal is to fracture the outer shell and expose internal oil glands without pulverizing the structure. This controlled disruption allows proper extraction while minimizing rapid oxidation. Use 4 to 5 whole cloves for a single serving. Place them in a cup, pour the hot water over them, immediately cover the cup with a small lid or small plate. This traps volatile oils and prevents evaporation of eugenol. Steeping time should be at least 10 to 15 minutes. Longer steeping, up to 20 minutes, increases extraction but also intensifies taste. That warmth and slight numbing sensation you feel in the mouth is eugenol interacting with local nerve receptors. That sensation is a sign of successful extraction. The liquid should be slightly amber to light brown. If it remains pale and flavorless, extraction was insufficient. Now let's discuss dosing. Cloves are potent. More is not better. The acceptable daily intake of eugenol from food sources is generally considered safe at low culinary levels. However, concentrated extracts or excessive clove consumption can stress the liver. In clinical toxicology literature, very high doses of eugenol have been associated with hepatic strain. For practical purposes, 1 cup prepared with 4 to 5 whole cloves once daily is a conservative and reasonable approach for most healthy men. Twice daily may be appropriate in some cases, but exceeding that regularly is unnecessary and potentially counterproductive. Now we integrate the second component, L-citrulline. For vascular support, typical supplemental ranges studied in clinical settings fall between 1.5 grams and 3 grams for mild support, and up to 6 grams in athletic performance research. For men over 60 seeking circulatory support, a conservative range of 2 to 3 grams daily is physiologically reasonable. It is important to understand that L-citrulline is not a stimulant. It does not force dilation. It supplies substrate for nitric oxide production. The body regulates conversion based on need. When you consume the clove infusion and L-citrulline within the same general time frame, you support nitric oxide production while simultaneously reducing oxidative degradation, production, and preservation. That synergy matters. Now let's refine this further, because there are 2 additional ingredients that enhance this protocol in a meaningful way. The first is pomegranate extract or fresh pomegranate juice in moderate quantity. Pomegranate contains punicologens and anthocyanins, which have been shown to improve endothelial function and reduce oxidative stress. Some small human trials demonstrate improved flow-mediated dilation, which is a measure of vascular responsiveness. Mechanistically, pomegranate polyphenols increase nitric oxide bioavailability and reduce LDL oxidation. When LDL oxidizes, it contributes to endothelial dysfunction. Protecting against that process improves vascular flexibility. Adding a small amount, approximately 100 milliliters of pure pomegranate juice, alongside the clove infusion enhances antioxidant protection without excessive sugar load. The second supportive compound is magnesium. Magnesium plays a critical role in smooth muscle relaxation. It acts as a natural calcium antagonist. Remember earlier when we discussed calcium influx and vessel constriction? Magnesium balances that process. Many men over 50 are mildly magnesium deficient. Suboptimal magnesium levels impair vascular tone regulation. A daily intake of 200 to 400 milligrams of magnesium glycinate or citrate can support overall vascular relaxation. Now we have a structured stack: clove infusion for eugenol and antioxidant protection, L-citrulline for nitric oxide substrate, pomegranate for endothelial support and polyphenols, Magnesium for smooth muscle relaxation and calcium modulation. This is not random. This is layered physiology. Now, let's discuss timing. There are two primary strategies: immediate support and regenerative support. Immediate support refers to consuming the protocol approximately 30 to 45 minutes before anticipated physical intimacy or activity requiring increased blood flow. Why 30 to 45 minutes? Because L-citrulline conversion to arginine peaks within roughly 1 hour. Nitric oxide synthesis increases shortly thereafter. Eugenol absorption begins earlier, but its vascular effects are more supportive than acute. The combined effect is subtle but noticeable in men with mild to moderate endothelial decline. Regenerative support is different. This involves taking the protocol in the morning on an empty or lightly fed stomach. Morning cortisol levels are naturally higher upon waking. Blood vessels are often slightly more constricted upon waking. Supporting nitric oxide early in the day may improve overall vascular responsiveness throughout the day. Consistency is more important than intensity. Daily endothelial support improves responsiveness over weeks, not hours. Now, a critical clarification. This protocol supports blood flow physiology. It does not override severe arterial plaque. It does not replace prescription medication for advanced cardiovascular disease. It does not compensate for uncontrolled diabetes. If fasting glucose remains chronically elevated, glycation will continue to damage vessel walls regardless of clove intake. If a man smokes daily, nicotine-induced vasoconstriction will counteract nitric oxide support. If blood pressure is uncontrolled, arterial stress will persist. This protocol enhances a healthy biological environment. It does not rescue a neglected one. There is also the question of tolerance. Unlike stimulants, nitric oxide pathways do not typically exhibit tolerance in the same way caffeine does. However, the body adapts to equilibrium. Periodic breaks, such as 5 days on, 2 days off, may maintain responsiveness, though data is limited. Hydration also matters. Nitric oxide functions within plasma volume. Dehydration thickens blood. Even mild dehydration increases viscosity. If you implement this protocol without adequate water intake, you blunt its benefit. So we now have clarity on ingredient quality, preparation precision, synergistic stacking, and timing strategy. But before you begin implementing any vascular protocol, even a natural one, there are medical safety principles you must understand. In medicine, the difference between healing and harm is dosage and context. Natural does not mean harmless. It means biologically active, and anything biologically active must be respected. Let's begin with dosage boundaries. Cloves contain eugenol, which in culinary amounts is safe for most individuals. However, concentrated or excessive intake can place stress on the liver. In toxicology literature, very high doses of eugenol have been associated with hepatic enzyme elevation. This does not occur at typical dietary levels, but it reinforces why restraint matters. Using 4 to 5 whole cloves in a single infusion once daily is a conservative approach for most healthy men. Doubling or tripling that does not triple the benefit. It increases metabolic load. More is not better. It is simply more. Now we move to interactions. Eugenol has mild antiplatelet properties. That means it can slightly reduce platelet aggregation, the clumping process involved in clot formation. For most men, this is beneficial, in moderation, but if you are taking prescription anticoagulants such as warfarin, apixaban, rivaroxaban, or even regular high-dose aspirin, combining multiple blood-thinning agents can increase bleeding risk. The mechanism is additive. Pharmaceutical anticoagulants inhibit clotting factors or platelet activity. Eugenol adds another small inhibitory signal. Individually, mild. Combined, potentially significant. If you are on anticoagulant therapy, you must discuss this with your physician before incorporating daily clove preparations. Next, blood pressure medications. L-citrulline increases nitric oxide production, which promotes vasodilation. If you are already taking antihypertensive medication, particularly ACE inhibitors, ARBs, calcium channel blockers, or nitrates, adding additional vasodilatory support can lower blood pressure further. For some men, this is beneficial. For others, especially those already well controlled, it can lead to lightheadedness or orthostatic hypotension, that sensation of dizziness when standing up too quickly. This is not dangerous in most cases, but it is a signal. If you feel unstable, dosage should be reduced or discontinued. There is also the issue of upcoming surgery. Because cloves may modestly affect platelet function, most surgeons recommend discontinuing herbal products with anticoagulant properties at least 1 to 2 weeks before surgical procedures. This reduces the risk of excess bleeding. If you have surgery scheduled, stop the clove protocol temporarily. Now let's address gastrointestinal considerations. Cloves are warming and mildly stimulating to the gastric lining. In men with active ulcers, severe gastritis, or uncontrolled acid reflux, concentrated clove infusions may aggravate symptoms. Eugenol interacts with mucosal tissue. In small amounts, it can be soothing. In larger amounts, or in sensitive individuals, it may increase discomfort. If you have chronic reflux or peptic ulcer disease, begin cautiously or avoid entirely until discussing with a physician. There is also the issue of metabolic context to consider. If you have uncontrolled diabetes, the fundamental issue is glycation damage to blood vessels. High blood sugar binds to proteins in arterial walls, forming advanced glycation end products. These compounds stiffen tissue and impair nitric oxide signaling. No natural vasodilator can override chronic hyperglycemia. Blood sugar control must be foundational. Without it, any vascular support is partial at best. Now we move to expectations. This protocol is supportive therapy. It may improve endothelial responsiveness, it may enhance microcirculation, it may modestly improve performance or warmth in extremities, but it will not reverse decades of arterial plaque in a week. Atherosclerotic plaque is structural, it forms over years. While endothelial function can improve within weeks, structural plaque regression requires sustained metabolic correction, including lipid management, exercise, inflammation control, and often prescription therapy. If a man expects a dramatic overnight transformation, he will be disappointed. If he expects gradual improvement in vascular efficiency over several weeks while simultaneously improving sleep, hydration, activity level, and nutrition, he will likely notice meaningful change. Now we return to something more important than any single ingredient. Circulation reflects total metabolic health. Nitric oxide production improves with regular resistance training. Even moderate strength training increases endothelial nitric oxide synthase activity. Walking after meals improves glucose disposal and reduces glycation damage. Deep sleep enhances testosterone production and vascular repair signaling. Tobacco constricts blood vessels directly. Even one cigarette produces measurable endothelial impairment. Eliminating tobacco has a far greater vascular impact than any clove infusion ever could. Body fat distribution matters. Visceral fat increases inflammatory cytokines such as interleukin-6 and TNF-alpha, both of which impair endothelial signaling. This is why I emphasize environment over miracle. Your body is not broken, it is responsive. If you reduce inflammation, support nitric oxide production, maintain mineral balance, control glucose, move daily, and avoid vascular toxins, endothelial tissue can recover remarkable function even after 60. Not perfectly, but meaningfully. The combination we discussed, properly prepared clove infusion, appropriate L-citrulline support, moderate pomegranate polyphenols, adequate magnesium, create a favorable biochemical environment, but discipline sustains it. If you approach this intelligently, monitor how your body responds, respect dosage, and integrate it into a broader lifestyle strategy, it becomes a tool, not a dependency, and that is the correct mindset. You do not need hype. You need physiology. You need consistency. You need to respect that vascular health is cumulative, both in damage and in recovery. Your body can regenerate if you provide the right biological environment. Endothelial cells turn over. Enzymes respond to stimulus. Blood vessels adapt to demand. Improvement is possible at 50. It is possible at 60. It is possible beyond that, provided the foundation is addressed. Do not chase shortcuts. Build systems. Support your biology instead of fighting it. That is the difference between temporary stimulation and sustainable function. Take care of your health. I'll see you in the next video.